I'm Dr. Michelle Morse, Chief Medical Officer and Deputy Commissioner at the New York City Health Department. There are a lot of excellent questions across New York City communities about the COVID-19 vaccines and pregnancy, nursing, and fertility. I want to share with you what we know. First, people who are pregnant or nursing can choose to be vaccinated. In fact, I vaccinated several pregnant women when working at our city vaccine hubs. Pregnant people are eligible to be vaccinated right now in New York State. But each individual has to make the decision for themselves and understand the benefits, risks, and alternatives. Pregnant people are known to be at a higher risk of having severe illness from COVID-19. There is limited data so far on the safety of COVID-19 vaccines in people who are pregnant because pregnant people were not a part of the vaccine clinical trials. However, both the CDC and FDA are monitoring safety about vaccination during pregnancy through our safety monitoring systems. Based on current knowledge, medical experts believe that the authorized vaccines are unlikely to pose a risk to the pregnant person or the fetus. Similarly, there is limited data from the clinical trials on vaccination for people who are nursing. However, data also suggests that COVID-19 is not transmitted through breast milk, and the COVID-19 vaccines are not thought to be a risk to the nursing parent or infant. If you're thinking about becoming pregnant, I strongly encourage you to get vaccinated now so that you are protected from serious COVID-19 complications if and when you do become pregnant. You do not need to avoid pregnancy for any amount of time after getting vaccinated. There is no current evidence that infertility is a side effect of COVID-19 vaccines. Claims of infertility are based on a misunderstanding of the science. The COVID-19 vaccines, like many other vaccines, work by teaching our body to create antibodies to fight the virus. Concerns regarding fertility are based on the idea that the antibodies will attack a protein in the placenta that has a few things in common with a protein found in the COVID-19 virus. However, the two proteins are actually very different, and our immune systems are smart enough to tell the difference. There is currently no evidence that these antibodies will cause any problems in pregnancy or for the placenta. These are important topics, and while pregnant people and people who are nursing do not need clearance from their healthcare provider to be vaccinated, I do urge you to talk with your provider if you have any questions or concerns. Your decision to get vaccinated should be based on your personal situation and facts from trusted providers and researchers. For more information, visit nyc.gov/COVID vaccine.